The WHO now calls COVID-19 a pandemic. More than 120,000 persons around the world have tested positive for SARS-CoV-2.
The international body is urging all countries to ramp up efforts to curb the SARS-like disease. Here's the full story.
COVID-19 is now a pandemic. This has been declared by the World Health Organization on Wednesday, after the SARS-like virus continued spreading at an alarming rate. The total number of COVID-19 cases globally is now inching closer to 130,000.
W.H.O has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction.
WHO Director General Tedros Ghebreyesus is urging governments to step up measures in curbing the spread of SARS-CoV-2.
I remind all countries that we're calling on you to activate and scale up your emergency response mechanisms. Communicate with your people about the risks and how they can protect themselves. This is everybody's business.
Ghebreyesus stressed, however, that the usage of the term pandemic does not carry legal significance. The WHO no longer has a category for declaring a pandemic except for influenza. The novel coronavirus is not the flu.
Describing the situation as a pandemic does not change WHO's assessment of the threat posed by the virus. It doesn't change what WHO is doing, and it doesn't change what countries should do. We have never before seen a pandemic sparked by a coronavirus. This is the first pandemic caused by a coronavirus. And we have never before seen a pandemic that can be controlled at the same time.
WHO also acknowledged countries that are taking on effective measures in controlling the virus spread.
We're grateful for the measures being taken in Iran, Italy, and the Republic of Korea to slow the virus and control their epidemics. We know that these measures are taking a heavy toll on societies and economies, just as they did in China. All countries must strike a fine balance between protecting health, minimizing economic and social disruption, and respecting human rights.
WHO's Emergencies Program Head Mike Ryan, meanwhile, notes that the situation in Iran is very serious.
We have part of our international team has already left Iran, but a team will remain on the ground with Iranian authorities. Clearly, the situation in Iran is still very serious. There's still a very high number of deaths. There's a high number of sick people. And while the number of cases and the intensity of surveillance has increased, we would like to see that increase even further. And we would like to see more support to the clinical care of sick people in Iran, both within Iran, certainly, but with our support and the support of the rest of the international community.
The SARS-like disease has spread to more than 100 countries. For News 5, JC Cosico, we are One News.